Now you're ready to begin the Zoom whitening treatment. First, you need to determine if your patient is a candidate for the procedure. A consultation is recommended to ensure that there are no underlying oral health issues. You may want to treat existing issues before offering the whitening treatment, and you'll also need to disqualify any patient who is perio-involved, exhibits failing restorations, or is otherwise in an unhealthy oral state. To better minimize sensitivity issues, it is recommended to prescribe about potential whitening results. Explain that results may vary. However, most will experience a 6 to 8 shade change. Anatomy, calcifications, age, teeth condition, and oral hygiene determine the results each patient will attain. Patients with yellow staining tend to whiten best. Patients with severe gray, tetracycline, and/or fluorosis staining will require additional follow-up take-home or further in-office treatment. These patients may experience less dramatic results, but should experience an improvement. Crowns and other tooth-colored restorations will not whiten. To maintain uniform color, tooth-colored restorations may require replacement following whitening. As with most whitening procedures, patients should be informed to expect mild to moderate short-term teeth sensitivity. A mild overall ache is normal and will go away in 24 to 48 hours. Some patients may experience occasional sharp pains during the procedure. These are also normal and will go away in 12 hours. During the consultation appointment, impressions can be taken for custom-fitted trays. When complete, trays should be placed in the tray case provided in the patient post-care and maintenance kit. Also, during this appointment, enamels should be free of moderate to heavy plaque and calculus buildup, preferably pumice just prior to whitening. Patients that require root planing should wait 2 weeks before their whitening treatment. Now place the light guide on the lamp. Turn the lamp on using the power button located on the side of the power pack. When the light guide is attached, the display will read Guide Status, Guide Attached, followed by 4 of 4 sessions, indicating the remaining sessions available and total sessions available. Then place the surgical suction tip provided on the high vacuum suction. Apply vitamin E to the patient's lips to moisturize before retraction. Then fully recline the patient and place their protective eyewear. Adjust the eyewear for proper fit and comfort around the ears. Insert the isoprep retractor at an angle, retracting one side at a time using a dental mirror to assist in placement. Allow the patient to adjust until comfortable, and then instruct to lightly bite down, applying continuous pressure. To best assess a patient's whitening results, we recommend to shade match teeth with a value-ordered Vita Classical Shade Guide. Document the starting shade in the patient's chart. Begin isolation by placing cotton rolls in the center of the upper and lower vestibules. If the cotton rolls are too large, unfold the provided gauze and twist in the shape of a cotton roll. Next, isolate with the gauze included in the Zoom kit. Fully open the gauze squares and fold into a triangle. Place the apex of the triangle into the posterior cheek. Tuck the balance of the material into the cheek, tucking ends between cotton rolls and the retractor. The supplied gauze has been tested and is proven to provide superior protection with the Zoom lamp. Do not substitute your own gauze for this procedure. Carefully place one face bib around the retractor, one side at a time. Add an additional bib for heavy salivators. Liquidam Dental Dam is used to completely protect soft tissue. It is important to ensure that no pink is showing. Twist to remove the cap and attach the metal tip, making sure it is secure and locked into place. Dry the soft tissue and begin by scalloping barrier material to the CEJ area on the upper teeth, slightly overlapping enamel and interproximal spaces to form an enamel seal. This overlap will not affect results as hydrogen peroxide penetrates the entire tooth, including the root. Cure the application of Liquidam on the gingival margin using a curing light like flashlight. Liquidam is a resin blend that can become warm upon curing, so use a sweeping motion, moving light back and forth across the arch for about 10 seconds. Now change to the plastic tip and fill the space between the cotton roll and the line of Liquidam you just created at the margin and cure. Be sure to cover all interproximal areas, leaving no soft tissue exposed. On lower arch, apply Liquidam using the same method. Use the syringe tip to press lightly on application to ensure it's completely cured. The material should be solid and have no give. If necessary, cure arch again for an additional 5 seconds. The application should extend distal at least 1 tooth beyond the area receiving whitening gel and be about 2 millimeters thick. Remove the cap from the room temperature Zoom whitening gel syringe and attach the mixing tip. Now, apply the gel directly from the syringe to teeth about 1 to 2 millimeters thick, using the blue brush provided to ensure proper placement of gel. Raise the back of the chair so the patient is in a slightly reclined position, about a 45-degree angle. Align the light guide to the isoprep retractor. Place the end of the retractor into the slots located on either side of the light guide. Begin the Zoom session by pressing the Start button on the display panel. The light will activate and the timer will begin the first 15-minute countdown. It's normal for the light to flicker for the first few seconds. Press the pause button if the session must be interrupted at any time. To reactivate the timer, press only the pause button or the fourth 15-minute session will be lost. The lamp will beep once when 3 minutes are remaining and again 3 times just before the session ends. When the time reaches 0, the light will turn off and a long beep will sound. For each 15-minute session, remove the light guide from the retractor and gently pull the lamp away from the patient. Avoid changing the angle of the lamp arm or head to minimize readjusting for each session. Next, carefully remove the gel with the surgical suction tip and check the isolation materials to ensure no pink tissue is visible. If the patient notes irritation at the margin, use vitamin E oil to soothe tissue. If the patient notes tooth sensitivity, apply the Relief ACP gel on lingual surfaces for remaining sessions. The Relief ACP gel is provided in the patient post-care and maintenance kit. Reapply the Zoom whitening gel. Align the light guide to the isoprep retractor and begin the next session by pressing Start. Repeat these steps for each of the 3 sessions. For patients darker than A3, or if it's deemed necessary, a 4th session is available. Be aware that additional sensitivity may occur and patient comfort should be assessed and taken into account. Point out to the patient that the progress of each session will be tracked by the 4 lights on the top of the lamp head. A light will appear for each quarter of the session. These lights are also helpful for checking on the patient's progress and time remaining. For sensitive patients, it's recommended to use the included relief gel and incorporate the optional Zoom Light Guide Extender. The Light Guide Extender is available from your discus representative. To attach the Light Guide Extender, pull back the lamp head and attach the Light Guide Extender over the light guide while making sure the Light Guide Extender may reduce results. Therefore, a 4th session may be needed. Remove the light guide from the slots and gently slide the lamp out of the way. Use the surgical suction tip to remove gel from the teeth. It's very important to moisten the gauze and cotton rolls before removal to prevent tissue irritation. Use the cotton pliers to grasp gauze and cotton rolls, then gently pull the material out. All of the isolation materials should pull free from the mouth in one unit. Completely rinse the teeth and irrigate the oral cavity. If liquidam remains interproximally, remove it with floss. Measure the shade change by counting the shade shift according to the value ordered shade guide. Be proactive. Don't wait for sensitivity to occur. Dry the facial surface of the teeth with gauze. At this time, the teeth are dehydrated and may be sensitive to air. Relief ACP has been shown to decrease sensitivity and remineralize teeth. Place Relief into the take-home trays and seat on the patient. Normal wear time is 10 to 30 minutes. If trays are not available, brush product onto the teeth. Instruct the patient not to spit for approximately 3 minutes. Whitening requires maintenance. Personal habits that promote staining, such as smoking or coffee and red wine consumption, will affect how long whitening results will last. We recommend patients use the whitening maintenance kit provided to maintain the results following the Zoom procedure. Some patients may elect to do additional Zoom treatments, but